Hello, my name is Mark Gibson, and you're listening to the podcast version of the Teagasc Signpost Series, a weekly webinar that promotes and examines sustainability in Irish farming.
Good morning, and you're welcome to this morning's Signpost webinar. The Signpost webinars are brought to you in association with National Rural Network, Food Drink Ireland SkillNet, and Dairy Sustainability Ireland. This morning, I'm joined by Noel Meehan, who will take the questions, and by David Meredith and Francis Bligh from Teagasc. And it's quite a serious topic, looking at health and safety on Irish farms, looking at the research and some of the advice and statistics around health and safety. Francis, you're very welcome.
Hi Pat, hi Noel.
Good morning. Good morning, David. A serious and persistent topic where a lot of work has gone on over in the last number of years to try and reduce the level of accidents and deaths on Irish farms with mixed levels of success, I suppose you could say.
Yes, definitely mixed levels of success, but working hard in the right direction to try and. Last year was one of our best years in relation to reducing numbers, and it's something that we need to kind of, continue to work on. We had 10 fatalities, 10 families lost a loved one, and obviously each one of those was one too many. But it's a lower number than previous years, So it was 20 the year previous to that. So definitely we're making progress, and we need to make sure that that progress is maintained and improved on in the future.
And in doing that, it's really important that we understand, I suppose, the causes and begin to learn the factors that are going to have an impact in reducing that. And I think that, David, that's where research in this area is so important.
I mean, that's it, that for a long time, people were kind of pointing and saying, oh, the problem is, and they've focused on one particular issue. And what we'll see today is that, it's the wider context is really important in terms of understanding what are the pressures that are shaping the way farmers approach their work and how they do their work. And there's a whole social and cultural background to that as well that we need to understand if we're going to be effective in terms of designing practical initiatives that farmers can adopt themselves and adapt to their particular farm or their particular situation.
Okay, well, we're delighted to have the two of you. Two presentations coming up. So without further ado, I'll ask David to share his screen and begin his presentation, if that's okay.
Okay, thanks for that, Pat. Okay, so thank you very much, everyone. I'm really delighted to join you today, and I'm going to provide a brief overview of the issue of social sustainability of farmers, but particularly focusing on health, safety, and well-being. And in terms of understanding Teagasc's role in this space, for those of you who wouldn't be familiar with the Teagasc Together strategy, within that there is a real focus on farm safety. And improving the well-being of farmers as a means of delivering on our commitment to improving the social sustainability of farming in Ireland. And that's reflected in Strategic Goal 1. It has a number of sub-goals, one of which is securing farmer health, safety and well-being. And this is actually a departure on where we've come from in the past, where for a long time people talked about sustainability of farming, and that generally got translated into concerns around the environment, water quality, gases emissions, and so on, and biodiversity and other issues coming in there from an environmental sustainability point of view. And then there is that overarching concern with the economic viability of farming, so really the sustainability of food production. And when sustainability of farms was talked about, it was very much in the context of generation renewal. It was the idea that we have an older cohort of people and the need to bring in a new generation of farmers. In in this iteration of the Teagasc strategy, we've shifted away from that and begun to focus on the sustainability of the farmer, not just the farm. And this is a really important departure because it brings the issue of the challenges around health and safety and well-being to the fore, in terms of how do we make farming an occupation that is attractive, that people will want to come into, and that is not detrimental to their health or their safety or their well-being into the future. So Teagasc works in partnership with a range of people on this in this area, and our approach is to, and this is what you're seeing here today, our approach is to combine research with advisory in terms of working together to develop practical initiatives that farmers can adopt. But before we get into that, it's worth looking at what are the key challenges in relation to this issue of health, safety, and well-being. And there are many. And the graphic that you're seeing here is some work that I did late last year and this year, where I was talking to farmers about this really broad area and saying, well, you know, what are the issues? And when I began to kind of assess what they were saying, is that farmers spoke about what they hear from other people, what they hear other people want from them. They then talked about how they feel about that. And we brought the conversation around to what farmers think about safety and then what they want. And in all of this, it kind of pulled together that farmers are, you know, they're hearing lots of things from lots of different groups, whether it's consumers, policymakers, or society, and that's placing significant demands on them. But that's translated into feelings that are very personal to them. So some of them are worried about the future. Some of them are reflecting a perspective that everyone wants so much from them. And that type of comment comes from a background of people talking about, in the past, people wanted food. That's what policymakers wanted. That's what society wanted. And now it's people want sustainable food. Policymakers want high levels of animal welfare. So there's a lot more demands coming in on farmers in relation to how they go about their business. When we got into farm safety, we saw a lot of kind of shrugging the shoulders and going, well, it sure isn't farming dangerous. So that acceptance of the way things are. But when we got into what farmers wanted, it came down to practical solutions. It came down to the idea of people working in partnership together to develop those solutions, and that includes the regulators and policymakers. So there's a lot in there, and that reflects the fact that the high level of injury and death on farms is a result of the combination of very hazardous working and labor conditions in some instances. So things like working alone for long periods of time with large machinery or livestock, or working in difficult environments, so bad weather and so on. There's also a poor understanding of safety cultural determinants amongst key people. And here I'm talking to policymakers and regulators. And there's an absence of well-informed actions. So these are actions that farmers can adopt, okay? So we need to be co-designing with advisors and farmers measures to improve health, safety, and risk management. But the health and safety challenge on farms is compounded by, you know, the physically and mentally demanding nature of everyday tasks. And it's also the fact that they are everyday tasks, that everyday farmers are engaging with the task, whether it's coupling a trailer onto a tractor, it becomes routine, and frequently the risk, you know, becomes invisible. It's just something that you do every day. And sure, nothing happened yesterday and nothing's going to happen today until one day it does happen. There's that interaction with uncertain working environments and conditions that I talked about. And overlaying these structural aspects are challenges associated with the culture of risk-taking on farms. And we have to view it as that. There is a culture of risk-taking on farms. So conventional approaches to occupational health and safety that have been applied in other industries, and these mainly focus on education and awareness raising or regulation and enforcement, are fairly limited in scope, as most farmers are self-employed. So in a European context, that means that a lot of legislation around workplaces doesn't apply to them. Now, Francis will talk a little bit later about what legislation applies in Ireland. But even when this legislation does apply, or when there are measures that do apply, the number and the distribution of farms and farmers across a wide geographic area limits the effectiveness of these approaches. In other words, regulators can't be everywhere at the same time. So research evaluating these types of approaches has come under scrutiny internationally, and it's concluded that sustained improvements in safety cannot be achieved through training, engineering, or enforcement alone, as risk-taking is fundamentally conditioned by a set of factors, including behaviors and practices of the individual, which are in turn influenced by how they are inducted into work. And that induction process starts probably at the age of 5 in the case of farming. And this brings me to the point with regard to culture. And work by Sally Shortall and others has argued that understanding farm accidents requires analysis of how families are socialized to interact with the farming space, and in particular, to understand that within farm families, there is a socialization and normalization of danger. And that means that for many, accidents are to be expected, that they happen. And it highlights the need not to consider just the source of dangers or risks. So the idea that, you know, a PTO shaft might be dangerous, or a recently calved cow might be dangerous, but to think broader than that. So in order to improve health, safety, and well-being, and overall quality of life of farmers, the importance of this context has to be reflected in the design of interventions. And that's what we've been doing in Teagasc for some time now. And the approach taken is at the center of all of this is the concept of One Health. And it's the idea that the total health of the individual is important to how they can go about their daily job. And the healthier somebody is overall, the safer they will be as well. So it's a very holistic approach to thinking about health and safety. So we're not focused just on machinery or animals. We're also focused on the overall health of the farmer. And the approach that we've taken here is to involve end users. And end users for us generally mean advisory colleagues and farmers as well. And the importance of the advisory side is very obvious in terms of they are the key intermediary with farmers who can talk about some of these issues around health and safety. And then, of course, we're working in collaboration with policy stakeholders as well. And this is my final slide, and this presents a very brief overview of the research program that we've got in place at this point in time. So we have at the very top there, Teagasc's strategic goal, which is about securing farmer health and safety and well-being. And then that's broken down into those 3 component parts of safety, health, and well-being in the thematic areas. And then the bottom line there with the variety of boxes, that points to the individual projects that we have, and the Safe Dairy one has recently completed, and all the others are ongoing at this time. And the first thing to say about this is that obviously it's fairly comprehensive. There's a lot going on here. The other thing to do is to put this in context. What we're doing in Ireland is exemplary by international standards. When you go to the States, when you go to Australia, New Zealand, and other places, yes, there is research going on. Yes, there are practical initiatives being designed and implemented with farmers. but very few places have the comprehensive program of research and advisory support around health, safety, and well-being. And relatively few have the partnerships that we have working with policymakers and regulators as well. So we are at the forefront of work in this area. And as you can see here, much of this work is ongoing. Really, this whole program for a long time was being really led by John McNamara, who can't be with us today. And then I became involved about 10 years ago, and we began ramping up the amount of work that we were doing across a whole range of areas. And we've been successful in getting funding from a variety of agencies, including the Department of Agriculture, to support this. But primarily, a lot of this is supported through the Teagasc Walsh Scholarship Programme. So we're very fortunate in that sense. In terms then of key outcomes, and I'm going to focus on a couple that are at a much more advanced stage. So that Safe Dairy project was all around co-designing and piloting and evaluating an occupational health and safety initiative with advisors to be delivered to through dairy discussion groups. And it took an approach of trying to assess what was the best way of delivering health and safety messages and how to engage farmers. And what we found is that the little and often approach, so it isn't a case that we say, right, the whole discussion group is sitting down for 2 hours now and all we're going to talk about is health and safety. That approach is good at raising awareness and getting people to intend to do something, but we find that they don't actually do it. The little and often approach is where it's broken down into 5-minute slots or 10-minute slots, and that encourages farmers to actually adopt changes, and it has been successful in doing so. The Farmers Have Hearts cardiovascular health program worked with trying to identify ways of helping farmers to adopt healthier lifestyles. And this is really important because 74% of farmers in Ireland have 4 or more risk factors for cardiovascular disease. And that places them at very high risk of having an adverse outcome. In other words, heart attack or stroke. So that work is about to be published next week. It'll be launched by a number of ministers and it's proven to be very successful. So you'll hear more about that next week. And then finally, I was doing some work with colleagues in UCC and the Teagasc National Farm Survey. And we were looking at the development of social sustainability indicators that could be incorporated into the National Farm Survey. And that work found that as farmers get older, they're more likely to experience stress, but at a declining rate. So the experience of stress is much more acute, but the number of farmers experiencing it declines. So that's that particular finding. And it highlights the challenge that we face in terms of dealing with this issue around well-being, that the same set of stressors can result in very different outcomes for individuals. And that's where the On Firm Ground training program for advisors comes in terms of trying to provide some basic knowledge so that advisors, if they do think that a client might be experiencing particular issues, or if a client says something, that at the very least, the advisor is in a position to respond and signpost that individual to the services that they might need. So that gives a very broad overview of what we're doing. And I'm going to hand over to Francis now, and he can take it from there in terms of talking about some of the direct initiatives that are being implemented with farmers and through the advisory service.
Okay, thank you, David. Very insightful. A lot of work going on behind the scenes in I suppose, trying to better our understanding and better our approaches to health and safety. I just remind you that the question, if you have questions for David or Francis, if you could put them into the Q&A. Thanks. Francis, if you want to take away the screen there.
Okay, thanks, Pat. Okay, can you see that, Pat? That's brilliant. Hello, everybody again. My name is Francis Bligh, and I work in the health and safety section of Teagasc, supporting the work of David and my manager, John McNamara, who can't be here today. So as David said, a very large amount of research, very large amount of work being done, trying to kind of drill down into what will work to try and make farms safer and help farmers become safer and help farming, I suppose, be sustainable into the future from the farmer's perspective, which is what David, mentioned a large amount of times in relation to. We look a lot about, I suppose, the environment and the sustainability of the environment, but from the farmer's perspective, there needs to be a focus there on him or her in how they farm, and that they can farm sustainably, into I suppose hopefully into older age, but that they can retire in good health and in good mental state, that they can enjoy themselves and pass on the farm to the next generation. For some farmers, I suppose health and safety has a big impact for them, and we look sometimes at the consequences of injury and ill health. And one of the big, I suppose, issues is the fatality rates. The tragedy of a farm accident or injury that happens, a fatality that happens on the farm, and the consequences it has for the farmer and for the farm family and the wider community. The pain and suffering that farmer can experience if they're lucky enough to survive the accident can be, severe and long lasting. And have a large amount of effect on them as a person, and all the supports around them then from the family that they have to provide for that farmer. And managing a farm after a farm accident can be very difficult, and takes a lot of effort from the farm family. And Embrace Farm is a voluntary organisation that provides supports to farmers that have farm accidents, which is very much needed. The loss of independence, sometimes farmers can't do what they were able to do before and need to get a lot of support, on the farm to maintain it. And sometimes the farm has to change. The farming system has to change to allow that farm to continue in a different way, with the farmer, inputting in whatever way that they can. So consequences from a farm injury can be devastating. Where are farm accidents happening? Like the statistics from the Health and Safety Authority will show that they're widespread across the country, but largely focused in areas where stocking rates are higher or activities are more intensive. So you can see on this particular slide here, the Cavan area is I suppose one of the higher rates there per 100,000 members of farm households. Trends in farm deaths, again, just I suppose it's very, it's a difficult topic to discuss, but it's important for people to have the information. And if you have the information, you'll know who is at risk, why they're at risk, and that there are people out there that have lost family members. So we can see from this particular slide here that the 19 to 64 age group are hearing the message. You can see the slide, the trend there is reducing, not reducing enough, but is reducing. So we are getting through to those people. The children fluctuates between maybe 1 and 3 per year, and we need to kind of get that down to 0 and keep it at 0. And we need to make sure that we do everything in our power to keep that number down. The over 65 age group is where there's an increasing problem for us in relation to getting that message into the minds of those farmers and the wider community that they're at high risk and they are losing their lives in increasing numbers on farms. So they are showing up more in the statistics as being the high risk category, that over 65. So that slide will show that. You can see the trends there between the various types and age groups. That over 65 age profile, is increasingly high. Now we have obviously the age profile of farmers, especially maybe in the dry stock and sheep sectors, is increasing over time, and that is a problem that we'll say from a policy perspective we need to kind of keep a focus on. But those farmers, are at high risk, and we need to acknowledge that, and we need to try and make people aware that it's important to try and keep safe on the farm. Again, I suppose the trends over 3 years is shown it even this particular slide shows it in more impact. You can see that maybe I'm able to kind of do the pointer. Laser pointer. Just this section here, you can see it's increasing over time. Now, stats over time can change an opposite direction as well, but that particular slide shows that those over 70s are increasing as well. So, that's just a message that we need to get out amongst our farming community, that in that age profile, you are at high risk. What's causing the deaths? I suppose, the 10-year trends there from the Health and Safety Authority to collect all this data. You can see the tractors and farm vehicles are accounting for 43% of the overall fatalities on farms. And when you add in the machinery at 10%, so tractors and farm vehicles plus the machinery that they're carrying, you're over 50% of the overall accidents, with livestock then at 19%. And when you look at those individually, like what's causing the accidents, it's a wide range: overturning tractors, being crushed by the tractor, struck by a part of it, impacts, pierced. There's a very large number of different ways that you can, I suppose, be exposed to danger and risk. And as David said, it's inherently dangerous. So you need to be very careful and conscious and aware when you're managing your tractor and farm vehicle on the farm. When we look at, deaths due to machinery, it's the same types, entanglement there on a PTO shaft or a part of the machine, being impacted by a part of it. The crush injuries are one of the main areas where we have, increasing numbers of crush injuries. People maybe, the handbrake on the tractor isn't just maintained to the level that it should be, or not applied when farmers leave their tractors, and the tractor or vehicle rolls, and the farmer isn't aware of it rolling, and is crushed by it. Or it might be just that the tractor is rolling as the farmer is trying to attach an implement on the back, and a small little bit of movement can cause a crush injury, and that farmer may not be able to get it away, may not be able to call for help, or the crush injuries are so severe that over time it causes a fatality. Deaths due to livestock. So I suppose a lot of people will think about the bull as being the most dangerous animal on the farm, which they are very dangerous at 18%. The cows and calves, are having a big impact as well. So those cows that are maybe recently calved or are about to calve, or are spooked. Sometimes cows and calves that are spooked by something like a dog, or sometimes even a cat, or some loud noise, and they move in directions that you don't anticipate. It can be very dangerous, and fatalities have taken place. Cattle also, maybe, putting them in for different types of activities, like maybe dosing or injecting or sick animals or whatever needs to be done. Those animals, when they're, in facilities that maybe aren't up to scratch, and gates collapse, crushes collapse, or maybe there's too many animals in a pen and they charge when they're trying to be moved. So if you have a lot of animals moving in a certain direction, there'll be a lot of pressure on whatever facilities you have in place for them. So facilities need to be up to scratch for the number of animals that you're trying to work with. As David said, the National Farm Survey do a lot of work in collecting information on farm accidents, and they show that the dairy industry there is highly represented in the accident rates. So 18%. They show that about 2,500 accidents happen per year, and 18% of them then are in the dairy area. So every industry or every system has been represented, but the dairy area is one that's overrepresented in the number of accidents that are happening. Now, these aren't fatalities; these are accidents that are self-reported by farmers as part of the National Farm Survey. Irish agriculture, we have, as we know, 140,000 farms. They're predominantly self-employed. So unlike other maybe countries, 92% of our farmers in Ireland are sole operators, or they're self-employed in their own farm. So, and then when you add in the families that are attached to those farms, there's 400,000 persons at risk in agriculture in Ireland. The average age of the farmers is about 58. And what I suppose John McNamara, if he was given this presentation, he would talk about the psychologically unbounded. So farmers being psychologically unbounded means that they're totally, I suppose, masters of their own, what they do each day on the farm. So they don't have to kind of follow the rules that would apply maybe if they're working on a construction site. They're mainly under their self-control. They decide every day what they do and how they do it. So to get into their minds when they're doing each task, to have safety there in their minds when they're doing each task is I suppose the focus and what we need to try and achieve. When we look at standards across other countries, and David does a lot of this type of work, we're the best within the best 25% in the EU. When we compare ourselves with other sectors, though, there is a bigger problem, and the HSA data show that nationally all workers, there's 1.5 deaths for every 100,000. In construction, it's 6 deaths for every 100,000. In agriculture, it's 18 deaths. So from an agriculture perspective, 18 deaths for every 100,000 persons is way out of sync with other industries. So agriculture has the highest rate of fatal injury for any major economic sector, and 7 times more likely to be killed at work and farming. So like if you take nothing away from today other than this particular, I suppose, statistic, it means that and you obviously already know that agriculture is very dangerous, but 7 times more likely to be killed at work and farming is a very high number, and it's something we need to work on. As David mentioned, the legislation that applies, the Safety, Health and Welfare at Work legislation 2005 is what we kind of work towards and under, which encompasses everybody at work in Ireland. So not just farmers, everybody at work falls under this legislation. What does that mean for agriculture? From an employer's perspective, so as we said, 92% of farmers are their own employer. So even though they're their own employer, they still fit under the legislation, and they have a duty to manage the farm in a safe way, to manage their own safety and manage the farm in a safe way. If they have employees or people coming in doing work, they must comply and cooperate with the employer. So the employer must have good standards of safety on the farm and procedures, and employee must comply and cooperate with those. When contractors are used, they must also cooperate with the farmer. The farmer is the overall manager of the farm, so contractors must carry out the work in a safe way, and if farmers, by I suppose direction of the farmers, and if farmers see things that aren't safe, they should call them out and ask contractors to do it in a safe way, or to slow down, or whatever the issue is. The farmer is responsible for making sure contractors are safe on their farms. Designers, manufacturers, and suppliers of materials all fit under this legislation. So when machines or different facilities are being designed, manufactured, and supplied, they need to be supplied in a safe manner, and that they're safe to use. There's a requirement on farmers to prepare a risk assessment. So that means all the risks and hazards on the farm are identified and controls are put in place. The Health and Safety Authority have regulations and code of practice and guidance and support documents available to help farmers to comply with this legislation. And Teagasc and private consultants provide half-day safety courses for farmers to, I suppose, build this into practical messages and how this can be done practically on the farm. So there's a legal requirement under the Act to do everything so far as is reasonably practicable. That means to do everything that you can do that's practicable to make the farm safe. It requires a risk assessment for 3 or less employees, or if there's more than 3 employees on the farm, then a safety statement is required. Employer has a primary duty to provide a safe place and system of work. So that's in the legislation, and farmers are duty bound to do that. What David mentioned earlier, and give a long list of, I suppose, the challenges that farmers face. And this is a picture that a lot of advisors would kind of use to have conversations with farmers about the issues that are on the farm. And you could sit down with a group of farmers and you could spend a half a day just going through each of those different sections. It might look childish really to look at it, but it does have a lot of the issues that we face in farming. And it does allow, I suppose, conversations to happen about certain things that are dangerous on farms. What action is needed? So what we try to do is to have conversations with farmers and through advisors on the ground and through messages and through, I suppose, social media posts and videos. We try to get action on the ground, what can be done practically. So, children, in this particular situation, what needs to be done? That particular child isn't in a safe location. That child should not be, standing there. The child should be safe in a safe area, safe play area. And if they're over 7, they can be in the tractor and in the tractor cab as long as there's a seat in place for them. So there's kind of ways of looking at farms, and if the farm isn't being managed safely, then accidents will occur. It's only a matter of time. As I said, the risk assessment documents as a guide for the various standards that are in place. So the HSA or the Health and Safety Authority produced this document. It has a large number of different sections and information for farmers to help them identify the risks and identify ways of making their farm safer and of doing tasks in a safe way. As I said, we have courses available for farmers that can participate in them to help them fill that document. We try to build, I suppose, a team approach, encourage farmers to think about safety and health during every task. So, when we're talking about, the sustainability of, getting slurry out at the right times of the year, we also talk about how that slurry is going to be applied, the machinery that's going to be used to apply it, making sure that at this particular time, when you go in to agitate your slurry, that you take out all the animals, that the doors are open, that it's done on a windy day, that you don't go into the shed for the first 40 minutes or more in the case of larger tanks, that there's a safe procedure there in place, and that when that machinery has been used, that it's well maintained and it's been worked by or operated by competent operators. So there's a sustainability message built in from a health and safety perspective, as well as an environment perspective. Vehicle knockdowns and faulty procedures. Tractors are becoming larger. The visibility is maybe not as good as it used to be on the smaller machines. They're traveling faster. They're carrying more weight. So vehicle knockdowns are becoming an increasing problem on farms. Cow attacks are becoming an increasing problem on farms, as well as breeding. I suppose policies, we need to kind of work towards breeding more docility into our herds. So that's a management decision over time to try not to keep those animals that are visibly and in practice not easy to control on the farm, to make sure that they're moving out of the farm and that the ones that are being bred are ones that are easier to manage. Calving facilities that, when there is money available, and I know with, I suppose, current situations, the price of steel is increasing dramatically and quickly. It's hard to fund these type of this type of equipment, but there should be money put aside every year to try and improve facilities on the farm and try to do small things that can make a difference each year. As David said, the small little bits that you can do regularly will all add together to be a big change over time. Silage pit size over the next few weeks, we'll have, hopefully when the grass starts to grow, it hasn't been growing much so far, but when silage starts to be brought in, silage pit sizes, contractors having to go higher with silage pits, trying to put facilities in place that make the farm as safe as it can be. Machinery, it's not just PTO shafts. And when you think about, machinery, not just the PTO shaft getting entangled on it. Obviously, you need to have a good cover, chains in place, the U-guard in place, the O-guard in place on the machine to make sure that there's no place where you can get entangled on the rotating PTO shaft. But there's other areas that you will get, crushed or other injuries associated with these machines. So not just thinking that when you have the PTO shaft cover on that everything is safe. Driving this machine, operating this machine, you're carrying weight, you're carrying a lot of content. You may have different types of equipment on the back of these tractors. It all takes a competent operator that's aware of what they're doing and conscious of what they're doing and conscious of safety during every job that they're doing. What could happen next? As I said, a number of fatalities have happened where the handbrake hasn't been applied correctly or isn't working correctly, and tractors have moved small distances and farmers have become pinned and crush injuries have occurred. Fragile roofs, maintenance of fragile roofs, making sure that you're competent to do the work. First of all, you need to make that decision. or if you're employing people to do it, that they're competent and that they use the right equipment. So what is right equipment? It depends on the job that needs to be done. And it can scale from very small equipment right up to large equipment, depending on the work that needs to be done. But not to do work with equipment that isn't appropriate for the task, or that you don't have competence to do. As David mentioned, large numbers of different research projects in place to come up with messages that we can use that will help farmers think about their own safety and their own health. So circulatory disease, the standard mortality rate that Dr. Breida-Smith et al. Found was a circulatory disease. Farmers are 5 times higher likelihood of having an issue. Cancer 3 times higher, injuries 7 times higher than white collar workers. So that's another message to kind of have in the back of your minds when you're farming or when you're talking to farmers. Stress at the moment is a big issue, obviously with increasing input prices and the issues with trying to source different types of inputs. It can be a challenging time, and it's important to talk. It's a very good lifestyle to have, but the research has found that rural dwellers have twice the stress as urban dwellers. It can arise for a lot of different reasons, and it's important to kind of take action when you do feel that you are under stress or pressure. So talking to your ag advisor and your consultant about farming problems, or if you have any kind of, if you do feel under pressure, talk to them and they may be able to help you identify things that you can do to manage the problem, and they might be able to signpost you towards other services that are able to help you. As David said earlier, the On Firm Ground program is a training course for advisors to help them with this type of process, to, I suppose, engage with farmers, to listen, to kind of help them identify where they're at, and then to signpost them to support services if required. And obviously the GP is the first port of call where there's an issue that's acute and needs to be dealt with really, really quickly. So to keep that in the back of your mind. Again, we're lucky enough to be getting a lot of sun at the moment. So being sun smart is important. To slap on clothing, cover the skin, put on your sunscreen, put on a hat, seek shade, and put on your sunglasses. So that's the sun smart message. And it's important to think about it. When you're going out on a wet morning, you're thinking about putting on your hat and your jacket. When you're going out on a sunny morning, you need to be thinking about covering your skin and putting on your sunscreen and having your eye protection. Because over time, we have issues with cancers as Dr. Breida-Smith has found, and we need to kind of do things that we can practically do to manage those issues. Schemes that the Department of Agriculture, Food and Marine have in place to help farmers fund equipment from a safety perspective are under the TAM scheme and under the accelerated capital allowances for farm safety equipment. So what I'd say is I'd encourage you to talk to your advisor or your consultant about different types of jobs that you'd like to do, and to see if there's any grant aid or funding available to help meet some of the costs associated with that type of work. So how do you plan to manage health and safety? So it's taking ongoing practical action is the main message that we'd like to get across today. So, ongoing practical action, each task has been done, are you doing it safely? So that's the end of my presentation, Pat. I'll just stop sharing here.
Thanks very much. Very, very, very comprehensive. And just to remind people, if you have questions and answers for either of the two lads, if you put them into the Q&A section. I suppose a few things. You mentioned there towards the end of your presentation some initiatives that are there from the Department of Agriculture, and I suppose particularly in the last few years, I think the department have been trying to deal with health and safety across a lot of different initiatives. Is there enough being done, and are there other areas or other initiatives that we should be looking at from a policy perspective?
Well, I think there's definitely if that's, I suppose, directed from myself, Pat, I might answer it first and David might follow on from that. From my perspective, I do feel that the Department of Agriculture are focusing more and more on kind of building it into the various different schemes that are there or are coming out in the future. It is part of, the TAMS. There's an increasing number of pieces of equipment there that are being funded to try and, I suppose, so that we can see more of them on farms, that farmers are more, I suppose, eager to put them in place and are encouraged to put them in place. And also various schemes that are being brought out. I know in the I suppose the next version of the beef data genomics scheme, there is going to be a training course there on safety for farmers with livestock. So that's a new development, and it's something that is very much welcome, and is it'll kind of bring that message in and make it practical, make it kind of, when you are working with livestock, when you are out weighing your animals, what is the best and recommended practice to do that? So it's to build it into, as David said earlier, the small messages, to build it in over a large number of different schemes is very practical and definitely impactful. And the capital investment for farm safety equipment is a new scheme that came out the year before last, and it's really kind of, I suppose, moving forward this year in relation to farmers kind of thinking about uptake of it. And that means that you can write off certain equipment over a 2-year period from your capital allowances. So things like big bag lifters for fertilizer, quick attach mechanisms for putting on machines, they're all part of that particular scheme. And I would encourage anyone that's interested to talk to their advisors to go through those schemes to see is there any funding available to help them, I suppose, get some of that equipment out on farms and make their farms a little bit safer.
Okay, and as I suppose a very high proportion of our farms are now part-time farms where they're probably time poor and trying to race through jobs. Is that a significant factor? And are we able to get to part-time farmers with these messages as well as we get to full-time farmers?
Well, by definition, the part-time farmer is, I suppose, time poor. So they are sometimes more likely to put that equipment in place.
Okay.
So that means that they know that they have to do a lot of work at weekends, or they know they have to do a lot of work in the mornings or in the evenings. They have the off-farm work. Sometimes some of that money is channeled in to help them manage their farm and manage how they manage their farm. So facilities like better sheds, better penning, cattle handling facilities, maybe better equipment in relation to larger tractors, larger plows, larger machines if they're working in a tillage area. It depends on the system and it depends on what they're doing on their farms. But there isn't anything to say that the part-time farmer is less or more that I'm aware of. It depends on various years and various statistics. But there is evidence that the part-time farmer will spend more money on trying to make their farm more efficient, so that they can manage it in a way that means that they're spending less time there.
I'll just follow up on that one. So Francis is right around, the part-time farmer can be better set up, better facilities and so on. We did notice a number of years ago in the fatality data that we were seeing a trend of fatalities involving livestock incidents outside working hours, and that would include late in the evening and at weekends. So conventional working hours, not necessarily normal working hours for anyone from a farm background. And what we saw there was there was that trend towards out of working hours fatalities, and it was particularly prevalent in the BMW region, where there would be a lot of off-farm work and part-time farming. And it was particularly prevalent during the winter period. So it was that issue of working indoors, feeding animals or caring for animals during that period. So that trend has abated a little bit, which is positive. And Francis alluded to that a little bit earlier on. But Pat, going back to your original question around policy and what can be done there, and Francis outlined a lot of what the department is doing at the moment. One of the things that a number of us have discussed, and I'd certainly like to see, is effectively a top-up payment for strategic planning of the future development of the farmyard. So farmyards, they evolve over time, and very few of us are starting from a greenfield site. So there's that need to think about, okay, how do we make farmyards safer into the future, particularly in the context of, machinery is getting larger, or the scale of the farm is getting larger, or something is changing around it. And this is where I think working with farmyard building contractors, farmyard designers, and policymakers to come together to say, right, okay, if you put in place a 5-6 year plan around, or a 10-year plan around, the future development of your farmyard, we can, either cover the cost of that or provide top-up payments as you begin putting in place new infrastructure, and integrated within that are safety measures. So better handling facilities, better, separation of people and machinery, and so on. So it's just, we're doing a lot, but I think there's kind of strategic elements that we can bring into this that will help in the long term.
Okay, and when we talk about it, we talk about health and safety, and I think there's a couple of questions in there alluding to the starkness of the health statistics that you have presented there. And to some, it's counterintuitive, because the impression might be there that an outdoor life, an active life, should be a healthy life. What are the key factors behind the reasoning behind why those health outcomes for farmers are so far out of line with other workers?
Yeah, I mean, it is very stark, and it really goes against a lot of what we would naturally think. And I suppose in a lot of respects, machinery is taking a lot of the strain these days. So you find that the physical nature of the job is a lot of pulling and dragging, which is placing a lot of strain on the individual. There's also that aspect of, the activity is not very intense, so there's less of a cardio benefit arising from it. So there's those aspects around the activity of farming. The other aspect then is, the working alone for long periods of time. I don't know about anyone else, but I know when I'm kind of hard at it, I'm not really eating well. It's whatever's to hand. So it's snacking, it's that sort of thing. So the healthy eating side of it is difficult to maintain. So there's a variety of factors that come together that make, farmers more susceptible to having a poor lifestyle. But the positive message that we can take from the work that we've done on the Farmers of Heart's cardiovascular health program is that with really a little bit of help, it's not a huge intervention by any means, but with a little bit of help, farmers do improve their lifestyle, and they do improve their health. And we know this because the way we designed that particular piece of research, farmers went in at the very beginning, they had a health check, and then at the end, after a year, when they had adopted, or they opted to try a number of different lifestyle behavior change initiatives, we found that most of them stuck with it. Most of them made big changes that were beneficial to them. And even where the benefits were really marginal for themselves, they felt better. So there's a real positive around that. And I know there was a question, and I'll be very quick on this. I know there was a question around, should health checks be mandatory? And that's a really interesting question. What I would say is that, the the Health Service Executive through the Irish Heart Foundation provides health checks for free to farmers at farmers markets every year. Now, there's only about 1,000 of them. They have to choose which markets they go to and so on. But we know that every year, 4 or 5 farmers are alive because they go and they do a health check. And, if you're a farmer, or if, a farmer, encourage them to go and get a health check, because it can make all the difference. And, those people were literally dispatched from the health check and told, go to hospital right now. and that was the serious nature of it for them.
No, a good few questions coming in. Apologies, I was hogging the question.
You're grand, and David there, that was a very good question that you answered as you answered it there. But there's another one in which kind of ties in as well from another listener around the quality of life index. So that kind of ties into what you're talking about there, David, as well. So look at just let me see. There was a question here around the lower death rate last year, and inquiring as if it was maybe tied into having the lockdown and more help around farms, and maybe less pressure, less stress on individual farmers. If you want to maybe make a comment on that.
So it's a really positive trend, and we've been going that direction for a few years now. So I think it's not just because of the extra help around farms, but that's certainly part of it. So where we saw a big uptick in the number of accidents and fatalities was really around dairy expansion. So we had that huge increase in the dairy herd, and that generally happened on existing dairy farms. So you had much greater intensity of work. And somebody mentioned around the quality of life there, thinking about working hours and the time off, and that is a really important element of farmers being able to sustain the work that they do, just being able to take a break sometimes. So part of what we're seeing in terms of the trend, I think, is related to the fact that that expansion has taken place and the systems are now in place, and people are, they're working at that higher level now, but they've learned how to do that and they're organized around it. The other aspect then, and I'm picking up on work that Marion Breacher from Moore Park has been undertaken, is looking specifically at that work organization pre-pandemic and during the pandemic. And definitely there's more family labor. But the other interesting thing that comes out of this, and I know John McNamara has spoken about it as well, there was less engagement in other farming activities. And what I mean here is like going to meetings. So there was more time and less pressure overall. And that seems to have fed in to improving overall well-being and also safety.
Just one very quick one, because we're nearly up against time, but just from a listener that was at a recent health and safety course and felt that there was maybe could be modernize it a bit maybe more, or is there any plans to maybe revisit the course and see, can we add in a little more on mental health and nutrition and the kind of things that you're talking about here today?
Yeah, I might take that, David. Well, the Engage program is a Department of Agriculture funded and the HSE funded initiative, and it's a training course for advisors in this particular area, to really provide advisors and consultants with knowledge and an ability, I suppose, to have conversations around stress and mental health and physical health with farmers. And that will help them then have better conversations during training courses for farmers. So when they're doing their half-day safety course and delivering it, they can have more engaging conversations with farmers on this particular topic. So that training course is the Engage program is ongoing at the moment. So hopefully over time that will have an impact.
Okay, Pat, maybe I give it back to you.
Yeah, and thanks very much. And I suppose the figures we quote, you talk about, I suppose, 20 to 30, maybe, and sometimes a little bit higher deaths each year, but those numbers build up over a time. And on a personal basis, I have 6 friends who have lost a parent in a farm accident. And sometimes when I'm thinking about that topic, it strikes me that those numbers really do build up over a period, and there's a lot of families out there where there have been tragedies, and some of which, if they were avoidable, it would be a huge service to everybody if we could manage to avoid those. So listen, thank you very much for your contributions, both Francis and David. Keep up the really good and the really important work. I think we have a long way to go, and I suppose particularly the extension into the health and mental health areas of farms. We have a lot of work to do in those areas, a lot of work for every advisor and everybody involved in farms to try and move towards better outcomes in those areas. So thank you very much for your presentations. They're much appreciated, and I think appreciated by our audience. Next week, we're joined by Dr. Stephen Nolan and Sean Connolly, looking at reducing the carbon footprint of cattle and pig slurry. It's a very big part of the emissions that come from Irish agriculture, and they'll be looking at ways of reducing that. So until next week, stay safe and have a nice weekend, and we'll see you again next Friday morning. Thank you.
You've been listening to the podcast version of the Teagasc Signpost Series, the weekly webinar that promotes and examines sustainability in Irish farming. Don't forget to join us live every Friday morning for our latest webinar. For more, visit teagasc.ie. And you can also rate, review, and subscribe to the Signpost Series on Apple Podcasts, Spotify, or wherever you get your podcasts from. I'm Mark Gibson, and thanks for listening.